Welcome back to Hourman TV, your trusted space for male sexual health, especially for men navigating performance issues with cardiovascular challenges. In our last video, we covered how to treat erectile dysfunction, a problem with getting or keeping an erection. But today, we're turning the spotlight on a completely different issue: premature ejaculation, PE, when things end too fast and you feel out of control. This video will help you understand what causes PE, how it affects your mind and confidence, and most importantly, the available treatments that can help you take back control. What is PE? Premature ejaculation happens when a man ejaculates too quickly, often with little or no control, either before or shortly after penetration. Unlike ED, which is primarily about blood flow, PE is a problem of timing and reflex control. The body's ejaculatory system is triggered too quickly, and the result is frustration, embarrassment, and dissatisfaction, both for you and your partner. Let's talk about the main causes of PE, which can be broken down into 4 categories. 1. Psychological causes: performance anxiety, fear of failure, and sexual insecurity, stress from life or relationships, and especially guilt. Many men carry shame from early sexual experiences, religious beliefs, or negative conditioning around sex. Guilt and anxiety can create a cycle where you try to rush through sex to avoid the discomfort, which then leads to finishing even faster. And each bad experience reinforces the fear, making the problem worse. 2. Biological causes: an overactive ejaculatory reflex or hypersensitivity in the penis, low levels of serotonin, a brain chemical that regulates arousal and release. Sometimes inflammation of the prostate or urethra can also contribute. If you feel pain in your urethra, be sure to check it out. Urethral pain will surely cause you to finish faster. 3. Habitual causes. Let's talk about masturbation. One of the most overlooked contributors to PE is the way a man masturbates. Many guys develop the habit of rushed masturbation during adolescence, in secret, under pressure, afraid of being caught. This quick release programming gets wired into your nervous system, training your body to see sex as something you must finish fast. Even worse, when this becomes compulsive or frequent, it dulls your control, increases sensitivity, and builds unrealistic sexual expectations. Some men even use porn to the point that their real-life intimacy feels less stimulating, making them even more nervous with a partner. If you're dealing with PE, one of the first steps to healing is this: stop masturbating. Give your body and brain time to reset. It's not just a bad habit, it's part of what's keeping you stuck. Do not pay attention to any advice that encourages it for whatever reason. There are other ways to prevent prostatitis, STIs, and pregnancies that doesn't involve killing your sex life. 4. Relationship dynamics. A lack of communication or emotional distance from a partner can add pressure. Some men feel like they must prove themselves in bed. This mental burden pushes them toward climax before they're ready. Let's be honest, PE isn't just frustrating. It hits your pride, your confidence, and your relationship. You may feel ashamed, like you're not man enough. You start to dread intimacy, avoid connection, or make excuses. Your partner may feel unsatisfied, confused, or rejected, even though the issue is neurological, not intentional. If left untreated, PE can create serious emotional distance between you and your partner and cause even more stress that makes the condition worse. It is also a step closer to erectile dysfunction. But the good news is, there are effective solutions. Before you jump into any treatment, it's important to see a urologist or sexual health specialist. They can help determine whether your PE is due to biological sensitivity, psychological triggers, or other medical issues. Diagnosis gives you clarity and helps guide you to the right treatment plan. Now, Let's explore those options. Here are the most proven ways to treat premature ejaculation. 1. Selective serotonin reuptake inhibitors, SSRI. These are prescription antidepressants like duloxetine or sertraline that delay ejaculation by increasing serotonin levels. They're not just for depression. In small doses, they give you more control in bed. 2. Topical desensitizers. Sprays or creams like lidocaine or benzocaine reduce sensitivity in the penis, helping you last longer. These are best used occasionally and under guidance, as overuse can numb your partner too. 3. Kegel exercises. PE isn't just mental. There's a muscle component too. Kegels strengthen the pelvic floor, giving you more command over your climax response. They help you hold back when you feel close to the edge. 4. Psychological therapy. If PE is rooted in anxiety, past trauma, or guilt, working with a therapist can help you reframe your sexual beliefs and restore confidence. This is especially powerful for men who grew up with shame around sex or had negative early experiences. 5. Lifestyle changes. Quit masturbation and porn usage. Get regular exercise, improve sleep, and reduce alcohol intake. Reduce anxiety through breathwork, mindfulness, or journaling. All of these contribute to more control, physically, mentally, and emotionally. You don't have to live in frustration or shame. Premature ejaculation is common, and it's treatable. But the change starts when you take action. See a doctor, stop harmful habits like porn and masturbation, practice the techniques, and give yourself grace as you retrain your body and mind. In our next video, we'll dive into natural and home-based treatments for PE and ED. So if this video gave you clarity, subscribe to Hourman TV and turn on the notification bell so you don't miss what's next. Your performance doesn't define your worth, but taking control will change your life. See you in the next one.